Good afternoon. My name is Natalie Billiard, and I will be presenting the burden for the family of a child with a chronic rheumatic disease. Here are the topics I'll be focusing on. Feeling alone, lost and unheard, being consumed with worry, fear and grief, feeling overwhelmed by information, communicating with siblings, family members and friends, acceptance and acknowledgement, finding the silver lining. Pre-diagnosis, our family was actively living life, travelling, working and enjoying each other's company. We had just returned from a 2-month holiday in Australia and Dubai when I noticed that our child was getting sick. She had a strange rash all over her body, spiking fevers and sore throat. To start with, I didn't pay much attention to it because I thought she just picked up a small bug on the plane. But after 10 days of not getting better, I decided it was time to take her to the local GP. Her pediatrician had retired a couple of months prior to our holiday, so this was a new clinic and a new doctor. Knowing that your child is unwell, seeking medical advice should be pretty straightforward. However, for a child who is showing symptoms which could tick the box for a multitude of conditions, there's no straight answer. There's no easy answer. In fact, diagnosis can take quite a while for many children with chronic rheumatic disease, thus leaving us feel like our concerns are being left unheard by their GP or pediatrician. The waiting game is one which no parent likes to play. It's traumatic to watch your child suffer and feel utterly useless and unable to help. It's heartbreaking. It's easy to feel alone or isolated because there is nowhere to turn for answers. There wasn't anyone in our intimate circle who could remotely understand what we were going through. There was no communication or clinical validation at that time that something was seriously wrong with our child, no matter how many doctor's appointments I took her to. Things were getting worse as far as I was concerned. She was constantly sleeping. She had very little appetite. She was in so much pain that she was unable to change positions at night. Her fever pattern was the same, 5 p.m., 6 p.m. each night. To me, it was obvious something was wrong. To the GP, it was just a virus. My daughter wasn't sent for blood tests. She wasn't sent for imaging. She was sent home with Panadol. By chance, around 6 weeks post-symptoms, I ran into her pediatrician in the market, and I frantically explained to her what was going on. She looked at my child sleeping in my arms and she said, "You need to get her to the hospital." I firmly believe that this chance encounter saved my child's life. Have you ever asked yourself, am I overreacting? Am I being neurotic? Is it just growing pains or a virus like everyone's saying? You see, the self-doubt that us parents put on ourselves is brutal. The misguided perception that one gets sick, goes to a doctor, takes medication, gets better, certainly isn't the case for chronic rheumatic disease. Seeing your child in pain and struggling to physically participate in daily activities is extremely difficult for parents. Worry consumes every waking and sleepless moment. Fear that the doctors have missed something vital and your child's physical and mental health is declining. Our child was diagnosed in infancy, so she couldn't verbally tell us how she was feeling. I was constantly observing her. I woke up whenever she cried during the night, which was roughly every couple of hours, and I would turn her over in her bed until she became more comfortable. The only topic of conversation you can focus on is your child, how they're feeling, the signs and symptoms they're experiencing, what they can no longer do each day. They may have stopped eating, they may be so fatigued that they're sleeping all the time or just resting immobile. There is only so much worry that us parents can take before we snap. One thing's for certain, our cups are not all the same sizes. Some will spill faster than others. We need to remember that each person will absorb what is happening around them in their own way and may react differently to each other at different and certain intervals. We'll all get to that level of understanding and acceptance eventually. The word chronic means prolonged or long during. And yes, we are all in this for the long haul. It isn't a race to find answers, and I can confidently say that now because I'm 11 years in. But I remember when my child was 8 months old, I wanted answers and I wanted action and I wanted it immediately. I had an overwhelming feeling that we didn't have time to waste. We all deal with adversity and emotional pain differently. For example, my husband threw himself into work. That wasn't because he loved my daughter less or he didn't care or didn't worry. His work helped him cope. It helped distract him. For example, it helped emotionally balance him so that he could be stronger for me and our children. I, on the other hand, solely focused on my kids. I didn't allow time for anything else. I'd got it into my head that we were going to lose our baby girl. And I wanted to create memories that would last a lifetime, not just for myself, but for her siblings. I wanted them to remember laughing with her, hugging her, reading with her, playing with her. Grief is a very real feeling when it comes to a child being diagnosed with a chronic illness. We grieve for the child we birthed. In the beginning, we grieve for our hopes and dreams for that child. We grieve for our husbands and their struggle. We grieve for the siblings and them witnessing the turmoil that our family is going through. We grieve for missed holidays, birthday parties, music recitals, sporting events. We grieve for all those little moments in between that we didn't take notice of because we were so focused on the illness and what it was doing to our family. When a diagnosis has been reached, we are given a lot of information all at once. Sure, there are resources for us to go home and flick through, but for every answer, there's 1,000 questions. Then there's the guilt of making decisions, mostly when it comes to medication. We were signing our child up for a biomedical drug trial. We were looking over the documentation, probably about 30 pages each, when we came to the part of limited data regarding short and long-term side effects. Our hearts dropped to our stomach. What were we doing? How could we play Russian roulette with our daughter's life if we chose not to go through with this? What other viable options do we have? Would we be condemning our child to physical pain, deformity, or death? We felt like our backs were against the wall in this moment. It was such an emotional time that my husband and I barely spoke to one another, not because we were angry or in disagreement. Neither of us could accept that we were handing our child over to science and hoping for the best. We felt guilty for wanting to try. We felt guilty for wanting to run and hide. One parent may be pessimistic and the other optimistic. One parent may want to happily jump into medication and the other may want to take a step back, put on the brakes, and really look into what we're putting into our child's body. The common goal is the same, and neither parent is wrong for how the information is processed and acted upon. I am someone who likes to feel in control of my circumstances, and let me tell you, I wasn't in control of anything. I knew nothing about this illness. I knew nothing about the medication that they were trying to give my child. For me to gain a level of control back, I needed to learn what this diagnosis meant, not only for my child, but for her siblings, for my husband, for myself, individually and collectively. I read books, I joined online communities, I questioned my daughter's rheumatologists, nurses, occupational therapists, physical therapists. I wanted to become my child's advocate first and foremost. I wanted to be her voice until she could be her own. And I do credit my child's rheumatologist for his patience. Oh, was he patient? And his understanding of our need to be back in the driver's seat. The only thing was we didn't know where we were going most of the time, so we needed him to be our navigator. We needed him to sit beside us with the map and direct us in the direction that he felt was the safest route possible. He made us feel like we had a partnership, that we too had a say in the direction our child's care will go. And that was enough for me. I no longer felt my child's diagnosis was a handicap. There's no easy conversation when it comes to explaining a life-changing illness. It's difficult for us parents to wrap our heads around it, let alone trying to explain it to children. It's heartbreaking to explain to siblings why their sibling is in pain, why they're spending days, nights, weeks in a hospital being poked and prodded. You can see the confusion in their eyes. You know that they don't really understand the impact that this is about to have on their lives. Choosing how much information to share is a personal choice. Each child is different, each family unit is different. We chose to be transparent with our children because we knew that they functioned better if they were prepared. No question that they asked was brushed aside or overlooked. They came to the hospital for consultations. They were welcome to sit with us whenever the rheumatologist needed to tell us something, or if they wanted to, they would go to the entertainment room next door. That was okay. They had the freedom of choice to be there or not be there. They held their sister's hand while she was getting her infusions and needles. They wiped away her tears, gave her cuddles, made her laugh. They admired her bravery. Communicating with friends and family should be easier because they are adults and they can comprehend the seriousness of illnesses and the impact that it may cause. Some family members or friends will be very receptive and supportive, whilst others may be dismissive. And well-meaning friends and family may remark or make comments that can be frustrating and sometimes infuriating. The comment that I know many families have heard is, "At least it's not cancer." I find this the most heartless. How can any adult compare two very different yet similarly devastating diseases? How can you tell to a parent? How can you tell to a parent that there's a level of comfort in that? It's not possible. The amount of time I have spent explaining to well-meaning individuals that no, my child's disease will not be cured by diet. It's ridiculous. Sometimes, no matter how much information you give, there will still be a lack of understanding. It's a case of pick your battles in the end. Accepting that this is our new normal takes time, but it eventually happens. I accept that there will be moments where I fail to assess my child's pain correctly, or when life gets too busy, I miss injection day. I acknowledge that my daughter doesn't want to be a sick child, so she will push herself much farther with more determination than anyone else in our family, sometimes to the detriment of herself. I accept that there will be losses, and by doing so, I release the pressure that I subconsciously put on myself. Most importantly, I acknowledge that along the way, you will meet people who truly do understand, because our paths, although not identical, are very similar. Finding your blessings amongst the trauma that this illness causes the whole family may seem like an impossible task, but there certainly are blessings along the way. Our family have met some incredible people all over the world. Others I have never physically met, but their presence in my life is just as important. I was wrong to sit and stress over all those negative thoughts. My children have adjusted well. They're compassionate, family-oriented individuals. Still to this day, they look out for their baby sister. They offer to help with her injections. They stay with her if she's feeling unwell. My son, studying university this year, chose to study a diploma of biomedical science. When he read me his entrance essay, the content was largely based around his little sister's disease and his experiences in the hospital as a young boy, accompanying her to her visits. We encourage our daughter to find her own limits and to be courageous in her pursuits, because if we don't encourage her to try, how will she ever know what she can achieve? She's enjoying her life and is making beautiful memories along the way. My passion is connecting families with each other, encouraging people to be a voice for their child and our community. Education and advocacy will bring a greater level of understanding not only for those of us affected, but it will also help shine a light on chronic rheumatic disease within the medical field also. In 5 years down the track, I hope that I never hear another family say that their doctor insisted that their child was suffering with growing pains or a viral infection without investigating further. I hope that our community will be loud enough to bring global awareness to the struggle that our children and our families deal with trauma daily. Thank you.